This is Edna Cadmus, my fellow co-lead for the New Jersey Action Coalition.
And this is Mary Wachter, my co-lead with the Action Coalition. And today we're really here to talk about the work that the Action Coalition has been doing for the last 2 years. We have over 200 volunteers participating.
Many of whom could be sitting in the room with you. Others are state legislators, government officials, members of industry, corporations, nurses, physicians, other healthcare providers who have been really helpful in helping to guide our work and provide insight that's really valuable to our efforts.
And now what I'd like to do is to begin to share with you some of the projects that we've been working on over the last 2 years. The first is around education, and we've been really focused around advancement of nurses in education, trying to reach the goal of 80% baccalaureate-prepared nurses by 2020. Well, we understand that this is really an ambitious goal. We needed to start somewhere, and so right now we have 2 pilot teams that are working, diploma, associate, and baccalaureate degrees, collaborating to look at the curriculum and to identify gaps and to really try to provide a progression that is seamless for nurses going into the profession. We also have practice partners with us from hospitals, long-term care, and home care agencies. The intent of those clinical partners is really to make sure that the content that's being delivered is really appropriate for the future of nursing and for the future of healthcare specifically. We're also developing a residency program. That residency program is focused on helping nurses transition into practice both in long-term care, home care, as well as hospital settings. Right now we have a grant submitted to the New Jersey Department of Health to help finance that test pilot for the long-term care facilities and to help nurses transition, since that's one of the areas where there's a lot of turnover, and we hope that we can help eliminate some of that turnover. And then finally, certainly engaging nurses through lots of forums across the state, again, to try to help them engage in helping the citizens of New Jersey. I would like to mention that we have received funding from the Robert Wood Johnson Foundation. We've received a state implementation grant for the academic progression component of this. It is for $150,000. We've also received funding from many of the magnet facilities to help support that initiative. And now I'd like to turn it over to Mary Wachter to continue on this.
Ensuring that nurses are able to practice to the fullest extent of their education and training is really important work of the IOM report and the Action Coalition. And to that extent, we are working to help nurses be able to adapt to the changing models of care as healthcare transforms, removing as many restrictions as possible to advanced practice nurses so that they're able to meet the needs, certainly the primary care needs of the many newly insured that will be entering our healthcare delivery system. Leadership is also an area that we have focused a lot of our efforts. In conjunction with the New Jersey Hospital Association, we developed a database that basically categorizes, catalogs and inventories many different nursing leaders from across the state. It categorizes them according to their practice area, expertise, education, political party, geographic location, and has been a great tool in helping us to get nurses appointed to state level boards, councils, commissions, private organizations, nonprofit foundations, because we truly believe that those organizations can benefit from the perspective of nursing, including hospital boards. We have requested and been hopeful and seen many hospital boards appoint nurses in addition to their chief nursing officers to their boards, particularly in light of the fact that with the transformation of healthcare and new models of care being evolving and needing to be delivered, that the perspective of nursing can be incredibly beneficial to hospital boards as well as other organizations. Finally, a other major area of our focus has been on creating a minimum data set for healthcare professionals, nurses, physicians, dentists, physical therapists, which we feel is critically important to addressing the supply and demand needs that are ever changing in healthcare, particularly meeting the needs, especially in the next few years, of the huge influx of patients, again, newly insured, entering the healthcare delivery system, and identifying where our shortfalls are and what types of professionals we need to ensure or are incentivized to serve in certain parts of our state. So we're incredibly dedicated to the work that's been going on and the planning that we've been able to do over the last couple of years, and now we're entering the activation phase of our efforts and putting a lot of our plans and projects into actual practice.